Thank you very much, Chairman Barrasso, and thank you, Vice Chairman Tester, for focusing on this very, very urgent issue. And I would echo what they said about Senator Dorgan. It's great to have you here and have you involved in Native American issues across the country. The conditions recently reported at facilities in the Great Plains region are horrific and unacceptable. My state also experienced halted emergency medical services at an IHS medical center in Crown Point, New Mexico last year. Patients deserve competent and timely care, and it's intolerable that any IHS emergency facility close for any amount of time. The difficult topics we are going to discuss today are not new, and unfortunately, staffing issues and the facility disrepair are becoming synonymous with the Indian Health Service. To help address these ongoing staffing difficulties, I've introduced a bill with Senator Murkowski that would make the IHS Health Professions Awards Program exempt from a federal income tax requirement as the National Health Service Corps currently is. IHS currently spends approximately 30% of its health professions account to pay taxes to the federal government, taking needed funding away from investments in skilled medical professionals. We need more resources for the agency to recruit and retain competent and committed staff. I will continue to push for this change, and I hope that the administration has more ideas about how to tackle this issue. I also want to take this opportunity to bring your attention to a public health crisis in my state. The area in and around Gallup, New Mexico, has long experienced an alarming number of alcohol-related deaths of Native people. Last winter, 17 people died from alcohol-related incidents, including exposure to harsh, cold temperatures. The NCI Detox Center in Gallup is currently the only detox facility serving the population in this remote and rural part of the state, adjacent to the Navajo Nation and the Pueblo of Zuni. An estimated 98% of clients served there are Native American. The center offers a desperately needed social detox program geared primarily toward protective custody. Since the facility serves such a large Native population, IHS needs to be part of the team working with local officials and other stakeholders to solve this public health crisis in northwest New Mexico. I'm pleased that the IHS officials from Rockville recently visited NCI Detox, which is expected to run out of funding at the end of next month. Senator Heinrich and I have been working together on this critical issue, and he and his staff have been great to work with. Later in this hearing, I will have some urgent questions about how the administration can creatively leverage current resources to help work on long-term solutions to this problem. I look forward to discussing the great need to help address the crisis in the Great Plains and the larger issues of IHS staffing and quality patient services and poor facility conditions. As was said earlier, this has been around for a long time. When Senator Dorgan was our chairman, we highlighted this. We would hope that the administration would come forward with plans to remedy this in an urgent matter. Thank you very much again, Mr. Chairman. Thank you, Mr. Chairman. Director McSwain, I understand the IHS is working to get emergency resources to the NCI Detox Center in Gallup. And as I mentioned in my opening statement, I believe there's a real public health crisis going on there. There's a very real risk that this center may close in a matter of weeks. You know, the community is alarmed. We've alerted you to this. When critical public health facilities close, people are going to die. That's what's going to happen. And so how can the IHS plan to work collaboratively and creatively with tribes and local officials in Gallup to fund a long-term solution to this funding issue? And how can the agency better leverage its resources to help address crisis situations like the one in Gallup, New Mexico?
Senator Udall, as you know, that we actually have identified resources that we're sending out to, but we're moving it through the nation. Yeah. That's the vehicle that's our relationship is with the Navajo Nation, and so we're going to be moving on the short gap. Then we're having conversations with others like our partners over at SAMHSA, about long-term strategies to maintain that program. It's a vital program, certainly for the Gallup community, and that's one that we desperately need to complete. But that's what we're doing right now, both short-term and long-term.
Well, thank you very much for that work. And as we've heard today, IHS facilities across the country experience interruptions in service due to staffing issues, poor facility conditions, deficient patient care. I mentioned Crown Point as an example. Secretary Wakefield is the recent glaring example in New Mexico. The emergency room in a rural area closed for over a month. Thankfully, the situation has improved, but I remain very concerned about the long-term success there and at other New Mexico IHS facilities, and as we've heard, facilities across the country. What is HHS's plan to address these serious ongoing staffing issues at IHS facilities? And then the bigger issue we're talking about, which is this whole issue of 50% underfunding. Senator Tester, Senator Heitkamp mentioned it. The National Congress of American Indians talks about 59%. I mean, what normally has happened in these kinds of situations that I've seen in the past is an administration steps forward. You know you can't do it in a year, but you step forward with a plan, a 5-year plan. We're going to wipe out this underfunding. And so I hope with this hearing and the attention that's given to this, that President Obama and your agency will step forward and give us a plan so we can get people to see here's the plan and who's going to vote for it and support it, because that's what's really needed here. Please go ahead.
We agree that there absolutely is a need to fill the gap, not just to recruit into underserved areas in Indian country, but also to retain those clinicians. And there won't be just one strategy to accomplish that. It's going to be a set of strategies. We have already been talking inside the agency about, for example, you were talking specifically about emergency departments. One of the strategies we've been focusing on, and that Mary Smith, the second individual that I mentioned, has been brought into the leadership of the agency of IHS, is focusing on, is a much more comprehensive approach to thinking about deploying telehealth technology. I'm from a rural area. I know the difference that can make. We have in Montana, and also out of Arizona, associated with our direct service facilities, direct service hospitals, the application of telehealth technology. Pine Ridge, for example, telebehavioral health. We have tele-ED out of Montana. So that is one strategy. I mentioned at the beginning that it'll take a number of strategies, but that's one strategy that I don't think we're leveraging as comprehensively as we could. It's important to back up those frontline providers in emergency departments that may see infrequently a particular case coming in with special healthcare challenges. It's also an appropriate technology to use in connecting to specialty services, so to back up primary care providers on the front end and also to deliver specialty services into particular areas. So I mentioned that because you mentioned emergency departments specifically. We have some resources that are going into telehealth technology applications. We're going to continue to look at that and push the boundaries of that out in our planning going forward. Telehealth doesn't solve it all. That's simply one strategy. Another strategy is also to make sure that we are investing in primary care providers to free up providers to provide care in acute care settings. And I've talked already about National Health Service Corps clinicians, but I should have also mentioned that we have markedly expanded over the last 5 years our community health centers. And as a result, today, our community health centers probably since about 2009, are seeing 30% more American Indian Alaska Natives than they had 4 or 5 years ago. That's great good news because that allows us to free up resources, personnel, to be able to provide other non-primary care services. So set of strategies from expanding technology, but also expanding the provider pool in a more comprehensive way, rather than just looking at this specialist by specialist, for example, rather leveraging those assets together.
Thank you very much for that answer and for for looking at this in terms of strategies. I'm a big supporter of telehealth, and I think many of the other strategies you mentioned, and you put them forward, and you're going to get a lot of support on this committee and in the Congress. Thank you very much, Mr. Chairman.